Hello, hello, everyone. So I know that it looks like I have a very scenic backdrop, but I am currently in a hotel with very limited lighting. So bear with me as we move through our amazing topic that we're getting into tonight. So this topic is very, very dear to my heart because, as you will see in a moment when I start my PowerPoint presentation, one of the people that I get to spend my life with, as well as work side by side with at IWG, is Dr. Nick, and he has I've firsthand experienced many, many concussions and brain injuries that he has gone through. The total number of head injuries that he has had has been 13 concussions at this point in time. So being able to see his journey and also the lack of knowledge there was about concussions and traumatic brain injuries, and also the mismanagement of these specific conditions has been something I've definitely dealt with firsthand. So tonight is really helping you guys to understand some of the things that are now coming to light about this specific condition and how it is creating a lot of aftermath and how it's actually playing a significant role in a lot of these conditions that we are seeing become more and more prominent, like dementia, Alzheimer's, and even Parkinson's. So really, my goal for tonight is to give you guys information and give you tools so that we can start managing concussions and brain injuries better. And we can also acknowledge the signs and symptoms that there might be something going on, because this is not necessarily about a person losing their memory within the moment, or even having a terrible headache, or having that that repeat, their brain on repeat saying, how did this happen? How did I get here? Those are all very dramatic symptoms that come from a severe head injury. But what we need to be more knowledgeable about is the mild head injuries and how we can start to see symptoms even weeks later. So as we dive in tonight, I'm going to help you guys understand more about these specific signs and symptoms, number one. Number two is I'm going to help introduce you guys to better testing, better therapies, and also better ways to really evaluate yourself or even your children in different changes that start to happen in their personality or even their behaviors, and how this might indicate that they have residual damage from their head injury. Okay, guys, by the way, I am on a webinar. There are a couple of you that are joining me here on Instagram. Instagram Livers, this is going to cut me off. You are not going to get full access. But if you do direct message me with your email address, I will make sure you get full access to the webinar. Okay, so just a bit about myself for those of you that are new. I am an integrative practitioner. Some of you might know what that means. Some of you don't. An integrative practitioner is really... the biggest thing is I ask better questions pretty much throughout the duration of my education, but also once I got into clinical practice, I started to realize that not many of my patients and what I saw coming through my doors actually matched the textbook. If anything, most people didn't match the textbook, and it leaves you a bit confused when you first start practicing as a new doctor. So I kept really challenging what I learned and asking better questions, and really starting to learn from some of the people that were pioneering in the world of functional integrative medicine. And I took as much knowledge as possible from all of these different places and all of these different people, and I started to evolve our own way of thinking as well as our own way of practicing. And this has really got us thinking about how healthcare looks at us as a bunch of separate systems. So when we get into this world of concussions, we're not necessarily having anyone evaluate us for, say, anxiety or depression later down the line, and then saying, oh, well, maybe your anxiety or depression is actually correlated to the fact that you had 3 concussions. Most of the time, your psychiatrist or psychologist is not even asking those questions. They're not even considering it, because they're just thinking that you have a chemical imbalance or you are not coping with stressors in your life properly. And then we're medicating in order to try to correct a chemical issue. But in reality, what is happening is we're not necessarily understanding, is there residual damage on the brain? Is there an autoimmune condition in the brain? Do we have a damaged blood-brain barrier that has now allowed for viruses to move into the brain? These are all things that we're going to talk about tonight that you guys are going to be like, holy crap, I didn't even think about that. I didn't even know that was possible. So it's really helping you to be more equipped moving forward. Or if you've suffered concussions or you have kids who have suffered concussions, now you have better tools and know what your options are. So for myself, I said I'm an integrative practitioner. That does not mean I specialize in one thing. I work with a ton of head injuries. I work with people that have suffered strokes. I work with people that have hormonal imbalance. I work with people that have autoimmune conditions. I work with a variety of different demographics because really at the end of the day, when you start to understand the body as a whole and you understand that all of these systems talk to each other and how one system can be compromised, that creates a cascade effect into other systems, that when you really understand that foundationally, you can help a variety of different types of people and a variety of different types of symptoms. So for me, as a practicing physician, I've been doing this for, it's crazy to say, almost 10 years. And now I have started to really be able to bring this information to other physicians through my institute, which has been an exciting transition. But I'm still working with patients. But I think that the biggest thing is for you guys, you are listening in from all over the place. And I think most of you are here because you also feel that there needs to be an evolution in how healthcare is being done. You feel that maybe you've been on a merry-go-round of not getting answers or being told you're healthy and your blood work is great, so you might be depressed or this might be all in your head. And this is the common theme that I hear every day coming through my doors, and it's exhausting because patients are really just, their symptoms are being ignored and nobody is digging deeper to really understand what's going on with them. But also it's not allowing you guys to be preventative in any way because you're being told, well, you know, your symptoms are not bad enough, or technically your results are not bad enough. So, you know, we're just going to monitor you and then we're going to wait until we find something really bad. That's the most mind-blowing to me, is when it comes to this thing that we call healthcare, really all it is disease care. We're not even talking about being preventative or providing a level of health. We're really just saying, oh, you're diseased now. Now we're going to just palliate it with a pill or a surgery. So there's my rant. But for those of you kind of wondering, you know, how did I get into this? I feel like a lot of the stories with integrative physicians is that they had a brain injury and they were really debilitated by it. And then they eventually started to, they worked with a physician that got them better. Or worked with an integrative physician that helped to get them better. But that is definitely not the case for me. I honestly thought that I was super healthy. And then when I started to actually do better testing, what I realized is I didn't know what I didn't know. And really what it comes down to is that you don't know what you don't know. And that's why you're here. And that's why I'm doing this webinar, because it's really important for you guys to get this information and to be able to know how to either resolve the issues you're dealing with from the head injury or to be preventative with your children that might have dealt with something that is low grade that's being brushed under the rug. So I know that we are almost 10 past 7. I'm actually on Central Time, so 10 past 6. There are a lot of different things going on around us, but give me the next 25 minutes of your undivided attention, and I promise you it will be well worth it, because I'm not going to sit here and give you the run-of-the-mill information and say, oh, if your child can't, you know, if they can't remember things past 12 hours, then that means it's a bad head injury. This is more so helping you to understand what does the aftermath look like, that you could be better equipped to understand what residually is happening from these head injuries, opposed to thinking my kid's just depressed, or I just have anxiety, or I just have insomnia now. So first and foremost, when we get into this topic, there are parents that are here that are listening, and they're probably going to start thinking like, oh my gosh, I'm a bad parent. I can't believe I didn't know this. I can't believe I ignored my kid's symptoms. And I just want you to understand is like, that's not the place to be from right now. This is not about going into this, I shoulda, coulda, woulda, because you don't know what you don't know. And it is impossible for you to be able to navigate the sea of information that is online. There is so much mixed information. There is mixed information that you are getting from doctors, neurologists, etc. And it's really just about understanding the big picture of how this works. And tonight is the night that you will be able to walk away with peace of mind, number one, but number two is also being able to be better equipped to be in the driver's seat. So some of you, as we go through this presentation, you're going to start thinking like, why doesn't every doctor do this? Or why didn't I hear this before? Or why isn't this what medicine is? And the thing you have to understand is that we have created a healthcare system that is on the foundation of everything being super separated and segregated. So if your kid has a head injury or you have a head injury, you're more than likely you're going to go to the ER first. And then if you have any additional issues, you're going to go to a neurologist. But a great example of this is that maybe 2, 3, 6 months down the line, you start to have gastrointestinal issues after a head injury. Not memory issues, or you're not having any type of headaches or anything like that, but what you're having is gut issues. So now you're going to go to a gastroenterologist. And again, that gastroenterologist is not going to ask you, have you had a head injury in the past year or few months? Because that's a neurologist and that's their specialty. So what you have to understand is that when you have a head injury, this is the brain, this is the control center. So you can easily start to have gut issues. You can easily start to have hormonal issues. You can easily start to have vertigo, dizziness, and other types of issues. But because we've segregated out everything into specialists, nobody is piecing the puzzle together. And that is really why we do what we do at Integrative Wellness Group, because we're trying to dig deeper, ask better questions, and really figure out the root cause and never overlook something that is going to be a major contributing factor to how you got where you are and why you have the symptoms that you do. So a couple of things that I think a lot of people don't know. So number one is symptoms of a concussion or aftermath of a concussion can actually set in weeks after the head injury. And this could look like brain fog. It can look like ADD. It can look like insomnia or poor sleep. It can look like gut issues. It can look like hormonal imbalance, loss of a period for a female. It can look like any of those things. In addition, when we're thinking about head injuries, we're thinking about contact to the head. We're not always thinking about car accidents. So many people are just like, yeah, I've had car accidents. It was minor, fender bender. And then when you start asking better questions, they're like, oh yeah, it was 15 miles an hour, 20 miles an hour, 30 miles an hour, but I was fine. I didn't go to the hospital. It only takes 5 miles an hour of impact to create soft tissue damage. So when we're talking about head injuries that can cause different changes in our mental health, yes, it could be impact to the actual head, but it also can be compromised issues from a whiplash or some type of neck injury, which can come from either a car accident or some other type of contact injury. In addition, we've already kind of said this, is that head injuries can cause a lot of different issues in organs that nobody is thinking about. And it's because you have this control center that is communicating down to a variety of organs. And one of the specific nerves that we're going to talk about tonight is the vagus nerve, and how that nerve specifically controls your heart rate. It controls your gut. It controls your respiratory rate. So when you start having gut issues after a head injury, or you start having heart palpitations, or you start having shortness of breath, this doesn't mean that you have a lung issue. This doesn't mean you have a heart issue. It doesn't even mean you have a gut issue. It means that you potentially have a vagus nerve issue that can come from the neck. It can also come from the head. The other big thing too is that you can have a head injury that creates damage to the barrier around your brain. This barrier is called the blood-brain barrier. And that barrier keeps all the bad stuff out. It keeps the toxins out of the brain. It keeps the infections out of the brain. For those of you new to this world, you might be thinking like, why do we have exposure to toxins? Or why do we get exposure to infections? You literally get exposed to these types of organisms all the time. And it's really, you have an immune system and you have this barrier around your brain in order to prevent anything from bad to get in. But when you have enough head injuries, you can actually start to have issues with the barrier around the brain that will actually allow for these infections and toxins to start creating bigger problems. So here's the breakdown of the cascade effect. So literally, we have the brain injury, then we have vascular issues that happen from there. These vascular issues actually create the breakdown of the blood-brain barrier. And then from there, we start to have issues with how well the blood is flowing in and the blood is flowing out. Just a disclaimer for you guys, what that looks like is headaches, migraines. It also starts to look like brain fog, memory loss. There are all of these things that so many of us are dealing with, and we are just not even connecting the dots because nobody is helping us to connect the dots. So in addition to that is when we start to have this breakdown of the blood-brain barrier, like I said before, this is when we have more susceptibility to certain viruses or even bacteria to start affecting the brain in a negative way. And this is definitely one of the big things that makes us susceptible to these autoimmune brain conditions like multiple sclerosis, Parkinson's, and even Alzheimer's and dementia. So we are living in a world right now that we're being told that we have no idea why these conditions exist. We have no idea why Parkinson's develops. We have no idea why people are getting Alzheimer's, when there is so much data and so much literature out there really correlating these conditions back to infections, autoimmune conditions, toxins, and head injuries, and more than that as well. So when we start to really understand the myths around these brain conditions and why we feel like we don't know what to do, we don't know how to handle them. So number one is that we assume that you or your child or whoever has had this head injury has had the best testing. We just assume that we did all the neurological tests proper. We also had MRIs or CAT scans to rule out anything serious, and that if the doctor says everything is good, then everything is good. And really what it comes down to is there has been no standard for how to do testing to properly evaluate for concussions or the residual effects of concussions, or what we call post-concussive syndrome. And this is just crazy to me that there still to this day is really no standard. You know, they're definitely asking questions and really evaluating the mental status of the person. Then they're starting to look at, you know, the movements of the eyes. They're evaluating the soft tissue. You know, was there any type of contusions or inflammation? And then we're doing CT scans to check for a brain bleed, and we might be doing an MRI as well. So really what happens from here is that if everything checks out, then we assume that everything is okay. And there's usually not a follow-up afterwards. So when it really comes to the testing that is necessary to be done, and for those of you that are like, who does this testing? There is a world in this integrative and holistic medicine world called functional neurology. And functional neurology, there's a variety of different ways to do it, but in our practice, when we're evaluating for concussion and in correlation to post-concussive issues, or even how this is affecting someone's mental health, we're looking at very, very strategic neurological tests. Everything from a test called Romberg's, which is evaluating your balance, coordination. It's evaluating how well your brain is talking to your body. We're looking at your tracking of your eyes. We're testing the cranial nerves. We're testing the constriction of your eyes. We're testing your reflexes. We're literally testing for the intracranial pressure in your head. We're testing for your hearing. We're testing for your sense of touch. We're testing every aspect of the neurological system to see, is there something that is not firing properly that is causing this person to potentially start to have anxiety, depression, memory loss, brain fog, etc. So interesting enough is that there are also blood markers that can be extremely helpful when you're trying to evaluate, does a person have damage to their blood-brain barrier in the current moment, or do they have damage to their blood-brain barrier post-concussion or post-traumatic brain injury. And what's interesting is in the early stages of my practice, I actually learned about these markers being markers for mold exposure. And really what I learned over time is that these markers really are markers that dictate a lot of inflammation, and they dictate damage to tight junctions as well as damage to the vascular system. So when it comes to this specific marker, these are accessible, by the way, through like LabCorp and Quest. These are not even fancy tests that you have to outsource through a private lab. But MMP and VEGF are two markers that can actually help us indicate, is there issues with the blood-brain barrier that is causing inflammation and destruction to the junctions. AKA what that means is that the blood-brain barrier is damaged, and that means things that should not be able to get into the brain can now get into the brain. And what that makes us susceptible to is viruses, infections, fungus, things that we do not want affecting our neurological system. It allows them to get in and cause problems. So in addition to that, is we have another marker called TGF beta 1. Again, we can get this simply through LabCorp or Quest. And this is another marker that is actually dictating if there is going to be vascular wall damage that could be affecting the blood-brain barrier. So really, just to keep this super simple, is these markers are dictating, is there inflammation in the brain? Number one. Number two, is there issues with how well the blood is flowing in and the blood is flowing out? Because the vascular system of your brain does two things. The arteries bring the blood in, which is going to help your brain get glucose, fuel. It's going to help it also get oxygen. Then you have your veins, your venous system that drains the bad stuff away from the brain. So that is the part of the immune system of the brain that's going to get rid of toxins. It's going to get rid of any infections that your brain might be stressed by. So once we start compromising the brain's ability to bring the blood in and out, we start to have a lot of problems. And guys, the first sign is brain fog. How many of you are struggling with your brain every day? How many of you wake up and are like, don't even talk to me, I can't even function, I need coffee first? So by the way, the reason why that helps you is because coffee is going to dilate your blood vessels, and it's actually going to bring more oxygen to the brain, but it's short-lived and it's temporary. So what that's showing you is that you already have issues with how well the circulation of your brain is actually working. So one of the biggest misconceptions is that there is no damage to your brain with a mild concussion or even a mild car accident. And when they started to actually do better testing on this, what they actually realized is that any patient who had a concussion had significant amounts or significant loss of gray and white matter of the brain. So gray and white matter, this is some of the associations with conditions like Alzheimer's, dementia, and even multiple sclerosis. So when you start to have damage to the gray and white matter, you start to have issues with how well your brain is communicating left to right, right to left, and also how well your brain is communicating top down. And the more compromised those structures become, your brain starts to shrink, and you start to have very serious conditions that cause you to lose your memory. They cause you to not be able to speak properly. They cause you to not be able to see properly. It really starts to compromise almost all of your senses. So this is probably one of the most fascinating parts of the presentation, because this is going to allow us to really understand the location of the injury is important. So a lot of times we're not even considering where did you hit your head, because your brain has a bunch of different centers. They're called lobes, and these lobes all do different things. So you have more than these 3 lobes that I've listed, but I'm going to keep it as simple as possible because most people are hitting the front of their head, which is the frontal lobe, and then most other people are hitting the back of their head, which is your occipital lobe, but also your cerebellum. So let's kind of break this down, and I'm going to help you guys understand what do these symptoms actually look like. So first and foremost, the frontal lobe of the brain. Some of the characteristics with the frontal lobe being damaged in a person is they have an inability to commit. I don't mean like boyfriend girlfriend status all the time. I mean like they change jobs a lot. They're not going to be able to commit to even like going to dinner. Like they have a lot of trouble with commitment, not necessarily just from a relationship standpoint. But they also have a lot of impulsive behaviors. They have a tendency to gamble. They'll do extreme sports. They like to speed when they drive. They're constantly getting speeding tickets. They'll make really risky financial moves. They'll like put all their money in one stock and hope for the best. But in addition, they can also start to have depression as well. So when you start to have the impulsivity and the depression, when you start to see the big seesaw, that's when you start to see more of the bipolar behaviors. But in addition, there are some things that you can also see if the frontal lobe is degenerating. So one of the questions I ask my patients is, do you have sloppy handwriting? Has it gotten worse over time? And some of them are like, well, it's always been sloppy, so that's pretty normal. But if they're like, oh yeah, it's significantly gotten worse over time, and it's also very small when they write, this is a sign that the frontal lobe is damaged and degenerating. In addition is that they maybe used to be more reserved, and now they're gambling a lot, and now they're having mood swings, and now they're feeling like the impulse is to cheat on their spouse, and then they're also feeling depressed about their behaviors. So these are some of the specific things that can happen way, 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 way later down the line after having a frontal head injury. And the other thing too is that, we have this epidemic of ADD and ADHD. And like first and foremost, one of the things that I think that a lot of parents need to understand is that the frontal lobe takes longer for males or young boys to develop. In addition to that, most of your kids are eating a boatload of sugar and crap. And it's because of the marketing. Your kids know McDonald's before you've ever taken them there. And it's because it's all over TV and their friends are eating it and everything else. So there is a lot of issues when it comes to the frontal lobe and blood sugar. If your kids have this roller coaster ride of blood sugar, or you have a roller coaster ride of blood sugar, because you eat tons of carbs and you eat tons of junk and you eat sugar on top of that, then you're also going to see more of a tendency for these behaviors, in addition to your kids having the ADD and ADHD. So this is not about running to the drugs. This is about evaluating, okay, did I give my young son or boy enough time to develop, or for that part of his brain to develop, before I really dictate if this is truly a pathology or not? And also, is my kid eating a boatload of crap that's creating really bad blood sugar, which is then cascading into what we presume to be ADD and ADHD? So some of the other big things too is that obviously when we're going into this ADD, ADHD world, we're starting to then stimulate the nervous system through different types of drugs. And the big thing that you have to understand is that the longer these drugs are used, the more we compromise the brain's ability to produce dopamine on its own. Dopamine is our feel-good hormone. So then when your child eventually tries to come off of these medications, they're going to have a lot of issues with addiction or even different types of vices. And this could be exercise, or it could be cigarettes, or it could be wine, or it could be other things. So when we start using these medications at really young ages, we actually manipulate the brain chemistry, and we actually change the the blueprint of the brain, and we actually create deficiencies that will then affect us and manifest differently later in life. So the back of the brain is what we call the occipital lobe. So one of the biggest things about the occipital lobe is it's tied to vision. So when I talk to patients, I'm constantly asking them about their vision. And by the way, if you guys want a podcast specifically about vision in the brain, we just did a podcast called Bad Vision Equals a Bad Brain, because we are dealing with, people just expect that their eyes are going to decline and degenerate. And then also when a child, at 1-2 years old is already in need for glasses, we're just being like, oh, it's genetic, they just have bad eyes. And we're not actually considering, is this from a head injury? Is this because they hit the back of their head? Is it because they had a flat spot on the back of their head when they were born and had to wear a helmet? Is it for any of those reasons? So when we're talking about the back of the brain, this is going to be visual. This is not just about, are you blurry? Are you farsighted? Are you nearsighted? This is also about, do you have to wear sunglasses when you're outside? Do you have issues with determining navy versus black? Do you have issues with shapes? Do you stare at something like stripes or some type of pattern that eventually makes your eyes really hurt? Do your eyes get strained really easily when you're on the computer? And I mean like for a half an hour. If you're on the computer for 8 hours, your eyes are going to be strained. So that is pretty normal. So it's not just about, do you need glasses, but are you colorblind to some capacity? Are you really sensitive to the sunshine? Are you having trouble with distinguishing shapes, colors, things like that? These are all things to look for of, did that head injury actually create more of a residual effect, but it's presenting as a visual issue. The other thing too to consider is ocular migraines, like a lot of pain behind the eye, and that the headaches or the migraines always look like that. Thank you. So those are definitely some things to consider. But in addition, when you hit the back of the head, you always have the probability that you start to compromise not just the visual centers through the occipital lobe, but you can also compromise what is called the cerebellum. So the cerebellum has a lot to do with balance and coordination. So if you feel that you used to be really balanced, but now you're having trouble doing yoga, you're having trouble standing on one leg, you can't pass a DUI test sober, you can't walk on a balance beam with your eyes open. If you can't do those things, then you have something going on with your cerebellum. In addition to that, your cerebellum works directly with your inner ear. So if you have vertigo, balance issues, if you have dizziness, if you have any of those types of issues going on, and you keep trying to address the ear, then chances are you might actually be dealing with a cerebellum issue because they communicate with each other. So these are all things that are really, really important to evaluate. So again, can you stand on one leg? Have you had bouts of vertigo? Are you dizzy? Do you get nauseous staring at patterns or being in a moving vehicle? Are you nauseous on a boat? Do you have ear problems, including stuffy ears or loss of hearing? And then when the cerebellum becomes really compromised, that's when you're going to start to see some type of tremor, especially when you go to grab something. A lot of people think it's blood sugar. It's not blood sugar. It could easily be degeneration of the cerebellum. So again, I'm doing this because I want you guys to be able to see these signs and symptoms, because these things are overlooked. Oh, she's just clumsy. Oh, I had vertigo one time, no big deal. Oh, I have motion sickness. I just take, my Dramamine and I'm good. These are all signs that your brain is not working properly. So the big thing too is that when we talk about the residual effects of a concussion, we're not really just even talking about damage to the blood-brain barrier. We're also talking about serious ramifications from adrenaline output. So when there is some type of head injury or concussion, usually this is going to be attached to something traumatic, like in that moment of hitting your head, playing sports, hockey, football, snowboarding, whatever, you're usually scared in a moment. And that outputs a crap ton of adrenaline. Adrenaline puts your body into what we call sympathetic mode, which is fight or flight. Literally, your body thinks, I'm in the woods about to fight a tiger or run. And what happens from there is that now that adrenaline creates a memory, and that memory will live in your tissues. And now, so not only do you have an issue with the damage, the physical damage that has happened from this head injury, but now some people get into this adrenaline overload or this sympathetic fight or flight state, and they can't get out of it. And now they lose their libido, their hormones are off, men will have erectile dysfunction, they're going to literally start having memory issues, they're going to maybe be lashing out, get angry, they're not going to be sleeping, and they're going to have no idea why. And it has so much to do with being stuck in this fight or flight adrenaline state. And the thing, I think it's coming up in one of my next slides, but the thing that I want you guys to understand about this too is that when your body gets into this fight or flight state, what's going to happen from here is that there's going to be that like moment in time when you go, because I hear it all the time from my patients and they're like, I just don't know what happened. Like everything fell apart one day. I just woke up and everything was bad. Like I couldn't think anymore. I couldn't get out of bed. I was so tired. I couldn't function. And I was healthy. I don't understand what happened to me. And what happens is that there are problems. There are problems in the background, but the symptoms are not severe enough for us to know there's a problem. And then it just takes the one thing. It takes the one fight with our spouse. It takes the one, fight with our boss. It takes the one bad strep throat. It takes the one bad sinus infection, the one bad stomach flu. And that just takes you completely over the edge. And it takes you over the edge because your body has already been in that fight or flight for a while and you were a ticking time bomb. And trust me, I know this very well because it was me. I was burnt to a crisp, running on adrenaline for probably 15 years. And this was, well, I did have a head injury. So that was just one layer to the fact of how imbalanced my life was with just literally burning the candle at both ends. And it took one bad flu that I literally could barely function anymore. And it's just important for you guys that nothing just comes out of nowhere. There's always things that are brewing, and it just takes that one thing that's going to take it over the edge. So when we really start to understand this issue with the blood-brain barrier, so like I've said, for those of you that are just hopping on, is that the blood-brain barrier, once it becomes damaged, like it's a shit show. I'm going to just be like black and white. This means that you have no protection and that infections, toxins, fungus, all the bad stuff can now get into your brain and cause a boatload of problems. That's number one. Number two is when your blood-brain barrier is compromised, you're also going to have a lot of issues with cell-to-cell communication. So that means your left side of your brain is not talking to the right side of your brain, vice versa. It means your brain is not talking to your muscles. It's not talking to your joints. It's not talking to your liver. It's not talking to your gut. Nothing is talking to each other properly. And then guess what happens? You're tired. You can't think straight unless you have caffeine. You're starting to become addicted to different substances that start to boost those feel-good hormones temporarily. You start to become depressed. You become anxious. Then you become bipolar. Then you develop early onset dementia. And then you have Alzheimer's. And then you have Parkinson's. Like, it's literally a cascade effect that happens over years upon years upon years upon years. But you guys need to stop just dismissing your brain fog. You need to stop dismissing your short-term memory loss. You need to stop dismissing those things because they are all significant. So this is kind of what I'm saying is this is a good visual. I know you guys on Instagram can't see this, but this is really just showing you that your eyes, your brain, your ears, any way that you receive information that is coming in through the senses, then that is going to be compromised. So your eyes are not going to talk to your brain properly. When you get things through your ears, that's not going to communicate properly. So you start to notice it with kids. Like, they're in school, they're like, I can't listen, I can't pay attention. Or you start to see them, they're reading a book, they have to read the same page like 4 times because they can't comprehend. I see somebody who wants to come be part of the live video. Just for the sake of the people that are on the actual webinar, just feel free if you want to pop a question into the comments area. Same thing with you guys on the webinar. If you have questions as we go, pop things into the chat. I'm going to go through a Q&A. So definitely do that, because whatever your questions are probably other people's questions. So it allows us to just kind of learn from each other. Another thing too is for those of you that are like new to this world of blood-brain barrier and probably are just like, does the blood-brain barrier really become compromised from head injuries? Like, is that even possible? And how do you test for that? There is a test for it, and I have it here because there is a specific lab that is pioneering in the world of neurological testing through blood work, and they are actually evaluating for the blood-brain barrier and to see if it is actually disrupted and compromised. So if you or your child has had 3-4 concussions, get this test done, because if it's something that is early onset, you can actually deal with it. So now there's not bigger issues down the line, because this is something that is actually fixable with the right tools, but most people don't even know that this is a possibility. So another thing that I've mentioned so far is that your head injuries, that when you have a head injury, it's not going to actually compromise how well your brain is functioning. And just so you guys understand is that your brain actually detoxes. It has its own special way of detoxing. So when all of you go to sleep and get tired, that's because at night your melatonin starts to go up. So what a lot of people haven't realized is that melatonin is not just about sleep, it's actually the master detoxifier of your brain and body. So this is one of the reasons why melatonin is going up at night, is to get you sleepy, get you to bed, to help your body detox and repair while you sleep. So melatonin serves many purposes. But when you have a head injury, the ability for your brain to make melatonin, number one, and also how well the blood flow and the cerebral spinal fluid flow, all of that becomes compromised. And especially becomes more and more compromised the more head injuries that are there. But guys, what does this look like? This looks like bloodshot eyes. This looks like migraines behind the eye or headaches behind the eye. This is tension. Everyone's, oh, sinus tension. It's not sinus pressure. It's not sinus tension. Half of the time it's your brain and the pressure in your head, the blood pressure in your head being so high. It's also brain fog. It's also depression. It's also anxiety, and it's also memory loss. It starts with short term. If you are a person that already has long-term memory loss, that is the progression. What that means is your brain is further degenerated. Short term goes first, long term goes second. And this is just a visual so you guys understand. So when we say this term sinuses, all of you think about breathing. But what you don't realize is that you have sinuses all through your head. And these sinuses are there to allow for us to have this fluid around our brains to drain the bad stuff away. In addition, the same exact company that is actually testing for the damage in the blood-brain barrier, this is also the same test that they are using in order to evaluate for specific viruses in the brain. This is something that I'm running regularly on patients, or especially my younger demographic, that are coming in with their ADD, ADHD, even Crohn's disease, because the brain plays such a significant role in the gut. And it's definitely one of the biggest viruses that I see in children's brains is HSV1. So for those of you, some of you know what that is, some of you don't. HSV1 is cold sores. That's the herpes simplex virus 1 that is associated with cold sores. So when you or your kids are getting tons of cold sores and you're thinking, oh, it's just a skin issue, think about it. Most of the cold sores are on the face, in the mouth. Think about how close that is to your brain. There are many, many kids that have this in their brain, and they're being told that they have depression, they have anxiety, they have pandas, they have sleep issues, and it's a virus. So I've already kind of mentioned this, but when we have these brain injuries, we start to compromise our neurological threshold. So like I said before, is we start to have this PTSD type of reaction because we output all of this adrenaline in the event of the injury. And then from there, it takes the one stressor, that's the straw that broke the camel's back. But in addition to that, when we have this threshold being compromised, we actually start to compromise our sodium-potassium pump. So just to keep this super simple, is what's going to happen is your brain is not going to get fuel and your brain is going to become very, very sluggish. So it's kind of mind-blowing because what's going to happen here is that I feel like somebody just said something about the volume, but it's okay. So what's going to happen here is that we have a lot of patients, we do testing when we actually test for what types of supplements are best for them. And when we test our patients that have dealt with traumatic brain injuries, or they're dealing with even brain fog or memory loss or things like that, they're always testing for something called biocell salts. So biocell salts are a specific fuel to the brain to help to correct the problems with the sodium potassium pump. And it is like clockwork that people are testing for this to be a positive to help their brain. So when you have traumatic brain injuries, it's almost guaranteed that you're going to have an issue with the sodium potassium pump, which again, all that means is that your brain is not getting fuel properly. The other thing about this is not just about sodium, aka salt. This is also about sugar. Your brain does run on glucose. This is not an excuse for you guys to go eat cheesecake tonight, by the way, because it's not how it works. But when you get glucose from the proper sources and also your body can use sugar properly, then what's going to happen here is that you're going to be able to give your brain proper fuel. But what they've actually proven at this point is that brain injuries will actually compromise how well your brain can use the glucose. So AKA, it is a massive, massive, massive struggle for your brain to get fuel and to communicate properly with your body, with your eyes, with your ears, with all of your senses. So everything starts to become more and more diminished. So I want to talk about this vagus nerve as well, because there is a huge epidemic of a condition called Pott Syndrome right now. Pott Syndrome is postural orthostatic hypertension. So all that this means is that, or I should give you the symptoms. So some of the symptoms that are happening with this Pott Syndrome is lightheaded, dizziness. People are actually, a lot of females mainly, are doing better. They have to lay. They have to be in a horizontal position because as soon as they become vertical, their blood pressure drops so severely that they could lose vision. They can faint. Those are obviously the more extreme cases. Pott syndrome has to do with two things: dysautonomia, meaning that your autonomic nervous system is stressed. Guess what, guys? All that adrenaline that we're talking about, that fight or flight that people get stuck in after head injuries, that is what's going to screw up your autonomic nervous system. Number two is if you hit your head, especially the back of the head, if you whiplashed your neck in a car accident, then chances are you can also have a vagus nerve issue. And the vagus nerve is going to play a significant role in Pott syndrome or fainting or low blood pressure. And the reason being is because the vagus nerve comes from the head and the neck, and then it innervates your lungs, it innervates your heart, and it also innervates your gastrointestinal system. So what starts to happen is that you become constipated, but no matter what you do, no matter what gut protocol you do, it doesn't help. So the gut protocols are not working because it's not a gut problem, it's a brain problem. And then in addition, you might notice that the person's pupils are always dilated, or they start to have heart palpitations or heart arrhythmia, or they start to have shortness of breath. And I'm talking about like they go up a flight of stairs and they're like, and they're thinking they have a lung issue when really it's the control center issue. So this is something that we really need to look out for in the event that somebody has dealt with a head injury. Some of the other really interesting things too, which so many of you and so many people you know are dealing with, is GERD, reflux, indigestion, heartburn. So one of the things that the vagus nerve does is it helps your stomach make acid. So by the way, most of reflux and heartburn is due to lack of acid If you want to learn more about that, I would definitely watch one of the other webinars that I did on the gut modules. If you actually log into our webinar archive on our website, you can get access to any of those, because that's a whole topic in itself. But when you have a vagus nerve issue, it's not talking to the stomach, you're not making proper acid, and then you're going to start to have reflux. In addition, it can also mess up your gallbladder. So now you're having a lot of gurgling, you're having issues with how well you're breaking down fats. You start to have poor liver detoxification, and then you start to become constipated. So these are all things that if you've tried, you've gone to cardiologists to deal with your heart palpitations, you've gone to gastroenterologists to deal with your chronic constipation, you've gone to gastroenterologists because of your GERD and your reflux, and it's not getting better, you need to look at the nervous system and the vagus nerve function, because chances are that is part of the puzzle. By the way, if you want a simple way to know if your vagus nerve is working, is because it's not one or the other. It could be either extreme. Is either you have a really active gag reflex, like you smell something bad and you gag, or you have zero gag reflex. So if you brush your teeth and you hit the back of your throat and you're like, nope, didn't gag at all. Either one of those extremes is showing you a compromised vagus nerve. So I've mentioned in this so far that head injuries can create an issue with the control center of the gut. So not only can head injuries compromise the vagus nerve, which will then potentially lead you down a road of chronic constipation, but in addition to that is that it can actually compromise the junctions on your gut. So this is what leads to what we call leaky gut. And leaky gut is, a whole topic in itself. But the biggest thing that I want you guys to understand about leaky gut is that every time you eat food, you're being exposed to bacteria, you're being exposed to parasites, you're being exposed to toxins, pesticides, herbicides, you're being exposed to tons of stuff. We all are. But your gut and your body is super intelligent, and it was designed perfectly to protect us. But if you have head injuries, then you can start to have a compromised barrier on your gut, which if that becomes compromised, now all of those little fun critters and toxins escape from the gut and get into your bloodstream. And then they get into your bloodstream and they make you inflamed. They make you more susceptible to autoimmune conditions, especially inflammatory autoimmune conditions like rheumatoid arthritis and fibromyalgia and even thyroid conditions. Really, it can trigger a variety of negative immune responses, which then lead to autoimmune conditions. In addition to this is that this will start to compromise your serotonin production, because most of your serotonin is made in your gut. So now you have a double whammy. You start to have gut issues, which lead to potential inflammatory issues, which potentially leads to autoimmune conditions. And then on top of it, you're depressed because your gut can't make serotonin. So again, we need to really understand the signs and symptoms here so that we can better equip ourselves to resolve these things. The other thing too is that most of our kids are going home after a head injury, being cleared by the doctor, and then they're sitting in front of TV, or they're sleeping with their cell phone next to their head, or they're playing video games because they feel fine. And what we don't realize is that not only is the radiation from those devices creating problems in itself, but secondary to that, all of the blue light that comes in through the visual centers is actually compromising the brain's ability to make melatonin, which doesn't allow it to detox, and it doesn't allow the brain to repair. I don't care if it was the most minor bump on the head that your kid literally was, had a bump from the monkey bars. Every head injury needs to be tended to properly. And even if it is minor and there's no reason to go to the hospital, don't let your kid go home and just sit in front of a blue light device like a cell phone or an iPad, because that is just going to be one extra thing that is not going to allow them to heal properly. And also for you ladies that are listening, blue light damages your skin. So if you're spending all the money on facials and all those things and Botox, try just putting a blue light blocker on your cell phone, and you'll probably notice your skin gets better. So there are obviously solutions when it comes to actually helping the brain from a preventative standpoint. Obviously, a lot of the things that we talked about tonight is really after the fact. But when it comes to being preventative, is even supplements like turmeric, curcumin, magnesium, biocell salts, and high dose omega-3s are extremely beneficial at protecting the brain. So if you are working with injuries, or I'm sorry, you're working with athletes, like your kids are playing hockey and they're playing football and they're playing these sports, then you really want to make sure that they are at least on some type of supplementation that is going to help to build better or healthier tissue in the brain that could actually act as a protective mechanism. So I'm not going to sit here and say that every supplement is created equal. There are so many variables. Please don't go cheap, because when you go cheap with supplements, they actually can become more compromising. Like omega-3s from Costco, guys, don't do it. Like, you don't need, first of all, the family pack that's going to last 1 year, because it goes bad. Number two is that when you get into supplements, very much follow the rule. If it's expensive, it's better. Unless you come to us and we actually will take all of that out, and we will make sure that you get the only supplements you get have been tested and they actually resonate with your body. So just know that, guys, because there are many people that have wasted a lot of money on supplements. And I know for myself, at one point in time, I had $25,000 sitting in a cabinet in my house, because it was trial and error. And then when we started to leverage better testing, we realized you can actually test to know what supplements are best for that person for the problems they're dealing with. And once you're able to hone in on that, first of all, you see the person get better faster, but you also see them not waste any money on supplements that are not good for them. So just know that you can get extremely personalized when you leverage better approaches. So this is actually a screenshot from one of actually our professors from when we were in school. And she is a functional neurology doctor, and she was really bringing some great research to the table. But I think it was just, I wanted to put this in here because I want you guys to understand that there are so many things that can be done even after the fact of a brain injury. So if you or your child have had just like a mild brain injury or head injury, and there was no need for hospitalization, there was no concussion, still being able to get some type of physical or manual therapy, get checked by your chiropractor, get checked by a vestibular specialist, get checked by someone who knows how to help those structures in order to make sure that you don't have problems down the line. Functional neurology chiropractors, sports chiropractors are literally the best for these types of issues. In addition to that is if you have already started to have symptoms, maybe you have symptoms with vertigo, dizziness, maybe you're having visual issues, maybe you're having other types of sensory issues, that's really when you want to go into more specific types of therapies like functional neurology, which is something that we offer at Integrative Wellness Group. A lot of people don't even know what that means. They've never heard of functional neurology. And it's really the simplest way I can put it is it's leveraging better, more precise neurological testing so that you can pinpoint, is there damage from the head injury? Is there residual damage, or is there risk for residual damage? And how can we either buffer the current symptoms or negate any potential symptoms from coming down the line? So I hope at this point in time that you guys are like, holy hell, I had no idea about any of this, but this is useful because this information is just something that I feel like is not being brought to the forefront. And there's still not great preventative therapies that are being offered to our young kids that are playing sports. And we're also seeing so many of these NFL players and NHL players that are completely debilitated by the time they're in their late 30s. And we need to put a stop to it. By the way, my Instagrammers, this is going to cut me off in 1 minute and 30 seconds. So again, send me your email if you want the rest of the webinar. So I think that we really need to understand that this is not about bad genes. This is not about bad luck. There are no genes that predispose you to having concussions. There are no genes that predispose you to Alzheimer's, or I should rephrase that. There are definitely going to be some types of predispositions, but your genes express differently based off of lifestyle, infections, your stress level, how many head injuries you've had. They will express differently based off of your situation, based off of all of those other factors. So even someone like my husband who has had 13 concussions, he is still highly functioning. He did the NeuroZoomer Plus, which is the test that I showed you guys, and his brain is better than most people. He had no infections. He had no autoimmune markers. And this is a guy who's had tremendous trauma, but he has leveraged the tools that we use at Integrative Wellness Group in order to get his brain back to where it needed to be and to really just decrease inflammation as a whole, and also to be preventative in the future for any type of activity that he still does. Because he doesn't live in a bubble now. He's still doing the things that he loves. He's snowboarding, he's rock climbing, he's doing all of those things. So it's really a matter of, you don't have to live in a bubble and not do the things you love because you're scared of a head injury. So it's really, really important to understand that, because one of the things that I advocate for is for people to live a balanced life. When you come to IWG, we're going to talk to you about, okay, maybe you should cut out certain foods that are causing more inflammation for your brain right now, but it's not that you're going to stay on an elimination diet forever, or you're going to stay on a certain protocol forever. It's always to just try to achieve a goal and to get you asymptomatic, and also to give you the tools of how are you going to best take care of yourself moving forward. I think so many of us don't gain those tools when we work with doctors. We still walk away feeling really reliant. We don't really know, okay, well, how do I take care of myself? There'll obviously be times when you have to use a doctor and have to consult with a doctor because it's out of your wheelhouse, but you should have a general idea of what your body needs to stay healthy. And I said this very, very early on. I know there are people that have just been hopping on later, but very, very rarely do your patients or your friends, your family, your kids that have dealt with head injuries, very rarely do they look like that concussion textbook description. They very, very rarely do. And this is one of the reasons why nobody has been managing concussions or post-concussion syndrome properly. So it's really time for a change. And it's really time to leverage better testing and better modalities that are out there. So for us, we really went from, first of all, we really questioned what the conventional methods were, which is, our traditional healthcare system. And when we first started practicing, we were all about functional medicine. And functional medicine was leveraging better testing in order to get better information. But what I found is that especially in cases like this with head injuries or traumatic brain injuries, is that diet and supplements was not enough, not at all. These were people that needed better intervention. They needed better detox methods. They needed neurological support. They needed neurological reprogramming, and they needed neurological nourishment. So we moved into this model of integrative medicine because it was really all about having more tools in the toolbox and being able to leverage modalities and expertise like functional neurology so that we can really be able to balance the brain out, get the brain talking to left and right, getting the brain talking to the body, and getting the body to talk back. Because you have to take care of all of those aspects in order to achieve the goals that people are trying to achieve when they're trying to recover from these head injuries. So people always want to know, how does this all work? This testing sounds awesome. I want, myself, my husband, my kids, I want, my loved ones to access it. So I will tell you this, is that I do think that we are really on an upward trajectory of seeing things change when it comes to how healthcare or how insurance is playing a role in integrative and holistic healthcare. But at this current moment in time is that insurance providers actually control doctors, and they do not allow for you to spend time. A doctor is allowed to spend 15 minutes at max. I cannot even do a neurological test in 15 minutes. I can do maybe just an eye test. I can't even do the rest of the tests, let alone ask you about your history, let alone ask you about your diet, ask you about your lifestyle, ask you about your stress level. I can't ask you any of those questions because I wouldn't have time. So for our practice, we've opted to serve you and not serve the insurance providers because unfortunately, most of the people that we work with have been on the merry-go-round. They've been on the merry-go-round of no answers, no results, no solutions. And if anything, they are in worse health and in a worse neurological condition from when they started to seek out the help of healthcare providers. So we choose to serve you. And with that being said, is people use their health savings account or their flex savings accounts, their out-of-network benefits. They use all that fun stuff. People use their in-network insurance to get their blood work covered. So there is definitely ways that we work with insurance. But when it comes to being able to spend the time that we need, that is the main reason we've opted out of being in-network. So I think this is just important to understand because this is not our practice. There are a lot of functional practices that are out-of-network, and a lot of patients don't always understand why. They think it's really just, about being difficult, but honestly, we just wouldn't be able to do what we do. And I really, from day one of going to school, I felt that healthcare should always be about answers and solutions. And what I realized is that most of our healthcare is just based on the foundation of getting a diagnosis, which is supposed to be your answer, by the way. But a diagnosis is really just merely a description of your symptoms. So when you're getting diagnosed with TBI, traumatic brain injury, that's just what happened to you. It doesn't actually give you any additional information about what to do about it and what damage did that create. People get diagnosed with irritable bowel syndrome. You have irritation in your bowels. What does that actually mean? What's causing it? What's the root? How are we going to fix it? So we've really opted to make sure that we give people answers and we also give them solutions. And we don't just do this with just our doctors. We have a whole team of people that actually work with our patients. So you get a team. And you get a team of people that all are experts in different things. So you get time with your doctor, you get time with your health coach, you get time with a nutritionist. And then in addition to that, you get a variety of different tests that are extremely unique that you have never seen before. So we do DNA-based testing, which allows us to get information within minutes, including the integrity of your blood-brain barrier, the integrity of your brain, your occipital lobe versus your frontal lobe versus your vagus nerve. We can see all of those things. We can look at the blood flow to your brain. We can look at the blood flow out of your brain. We can see all of these things through one of our technologies that is looking down to the DNA level. We also look at the bioenergetic system to look to see if there are chemical toxicities, to look for environmental toxicities like mold toxicity. We look for food allergies. We also look for heavy metals, minerals, vitamin testing. We do crazy, insane, comprehensive blood testing for autoimmune conditions. We look for those viruses in the brain. We look for bacteria in the brain. We look for all of those things. And honestly, one of my favorite tests, which I mentioned earlier, I told you I had a supplement cabinet of $25,000 worth of supplements before I knew better. And this was before we knew how to leverage better testing. And now we do not guess, we test everything. So when you come in and you're obviously looking for answers, but you also want to know, is this going to work? Am I going to get better? And, how are you going to help me achieve those goals? So with that, we leverage this testing to figure out what supplements are best for you, what herbs are best for you, what types of neurological therapies are best for you. We look at all of those things. One of the tests that I didn't even actually mention here, which is very relevant, is something called a QEEG, which is a quantitative EEG. This is actually a brain map. It maps out lobe to lobe to tell you where there is damage, where there is issues with your brain waves, where there is miscommunication between the left, the right hemisphere, the hemispheres and the cerebellum. It literally gives you a complete map of your brain. This is something that we do use in our practice, but we use it after we establish if there is inflammation, damage, infections, viruses, because you cannot rewire a brain that has dealt with inflammation or infections. You have to deal with that first. So one of the biggest reasons we've customized this onboarding process is because we were so tired of the really crappy testing that exists. When we look at testing, most of the testing just relies on one avenue. It looks at chemistry. It only looks at the chemistry of your blood. And we kept hitting into roadblocks, and we kept finding there were so many limitations. So we started to really dig deeper, ask better questions, learn, and we evolved our onboarding process. So we wanted to make it so that we could put all of this testing under one bracket and also be able to get you the best information in the shortest amount of time with the smallest investment. So when we are dealing with head injuries and we are dealing with now a person that has their personality is completely different, and we're just sitting there being like, I lost my husband. I lost who he is and who he was. My kid is a completely different child. Like now my kid is being medicated for depression, anxiety, ADD, and I don't know what to do. When you finally have clarity on why and what to do, I don't know if you can really put a price on that, because this is a world right now that there are just unfortunately too many people suffering, and there are too many kids that are in poor health. And I do these webinars, and I've done them literally every week for a year because it is my mission to get this information out there in order to give people an option for what can help them to actually get better. So obviously, when it comes to really how we do this and how you get access to all of those different tests, this falls under our onboarding process. Our onboarding process is $19.97. But if you work with our health coach and nutritionist in a lower tiered program, we actually have a program for $9.97. But I will tell you this, is that those of you new to this world might be thinking like, that's crazy. I've never spent that much on healthcare. And like, what about my insurance and this and that? Totally get it. Trust me, I do. I really, really hope one day that insurance is going to cover all of this. But I will tell you this, is that there are no surprises. You are literally going to get every single thing on that slide that I told you. You're going to get your doctor, your health coach, you're going to get your nutritionist, you're going to get all of your testing. There are no like, oh, we're going to run this test and this is going to cost you $600 and $700. So with that being said, is everything falls under this price bracket. And if you are dealing with a traumatic brain injury, you are going to most likely be working with Dr. Nick and myself, and not necessarily working with our health coach and nutritionist in the lower tiered program is what I mean. So the other thing about this is that if you feel that this really resonates with you, then we do ask for you to use this specific link in order to apply. We need to always make sure that you are a fit for us as we are a fit for you, because our practice is really just so customized on what we do, and we want to make sure that it's always a good fit. But if you use this link specifically, only this link that is available for 72 hours, you get $200 off your onboarding process. So again, use the link, because if you don't get that off. But make sure you apply, hop on a strategy call with our team. They will talk you through the process and have you understand a little bit more of how this works. If you are long distance, that is totally fine. You can work with us from a distance, because we do DNA-based testing and you have DNA in your hair. So we can actually evaluate your system through a hair sample. In addition, blood work and any of those tests will be outsourced local to you. And then obviously all of the results come to us. So I took a peek in here. Thank you so much. I really, really appreciate that. For those of you that are listening, I really, really love doing these webinars, and I really just like, for any of you that are still here, just please share this with other people, because there are a lot of people that are dealing with head injuries that are completely transforming their families for the worst. These are people that literally feel like they've lost loved ones because these brain injuries have completely transformed their personalities and taken away the person that, they married or the child that they gave birth to. So I really can't tell you enough of, how much I thank you guys for being here, number one. And number two is just please share this information with people so that they can have access to this and be able to know that there are options and that they are not powerless. So this is, one of my favorite things to do, and this is really an educational experience. Obviously, when you guys have your own testing and you get that clarity and you start to see changes in your own body, that's when this becomes truly a breakthrough experience. And I really hope that every single one of you can experience that at some point. But we appreciate you guys being here. We are going to continue the conversation about mental health this month and really having you guys understand not just about head injuries, but also how is this social environment and social media and the pressures that this is bringing, how is this affecting us mentally and emotionally, and how is this affecting the youth? So this is going to be some of the topics that we talk about as we move through the month. So definitely share this series with people that you know, and I appreciate you guys being here, and I will see you next week.